Well, hey, I just want to say welcome, Lance. It's good to reconnect with you. We just saw each other a couple of weeks ago at the Las Vegas conference. It wasn't a large group, but it was a good group of
It
engaged
was.
living and ARF professionals. You've been coming to these events for a number of years, our Reno event and our Las Vegas events. You've been a vendor with us talking about insurance and Medicare, Medi-Cal, educating our client base on these things. So I really appreciate you taking the time to join me today and kind of educate us more.
Pleasure.
So why don't you tell us about you and what you do, Lance, and who you work for?
Yeah. So my name is Lance Mishleau. My company is Partner Capital, and we're strategically partnering to protect and maximize your capital, your residents' capital. A lot of that is through two focuses: is life insurance and Medicare insurance. And that's what I really want to talk to you about today, is the Medicare insurance portion. For a handful of years, I was actually executive director of assisted living facilities. I've actually been going to the Reno event conference since about 2011 or 12, and I actually spoke there on the assisted living waiver program back some time ago. So almost probably about 10 years ago or so. Yeah. So the long history with community care options, believing in what you guys are doing and what the industry is doing as a whole.
Yeah, and you've been coming around and really enlightening a lot of our licensees on the important parts of Medicare. A lot of us as assisted living, providers, licensees, administrators, we're not thinking about Medicare. We know that our clients have it, but, we don't take it. We're non-medical. So we just generally don't think about it. But you've kind of explained to us all that it's really important that we are educated on, what the Medicare benefits are. And in fact, we can, to some degree, benefit from some of those offerings from Medicare. So you had mentioned that we're coming up on an important date for an annual election period. Tell me more about that.
Yeah, so the mass majority of RCFE assisted living residents have Medicare. And the time for them to be able to make their changes is actually the annual election period. And that is October 15 to December 7. That's when they come out with the new plans. And then you're actually able to make a change and adjustment for a January 1st effective date. So we're going to be looking at October 15th through December 7 to make changes for 2023 for January 1st effectives. And that's a time for basically all of Medicare to be able to make those changes.
Is there anything that our residents would need to gather up in order to do that? Any information that they would need to have on hand to make that election happen? Or is it just a matter of going online and taking care of it?
Right. So the biggest thing is to give me a call. Let me know that a resident is wanting to change, or they've got some questions on their prescription drug plans. Maybe they're wanting to know if they can maybe pay less money, and they want to know if they're getting the maximum amount of benefits. And some of those benefits, if your residents aren't getting transportation, if they're not getting hearing aids, if they're not getting over-the-counter supplies, sometimes it's anywhere from $60 a year to $1,200 a year for over-the-counter supplies. That's a big deal for a lot of residents who don't have a lot of extra money. That helps to be able to cover vitamins, minerals, special kind of socks or shower chairs, depends, many different items that a resident might be looking for. There's a lot of insurance companies out there that can provide a substantial amount of over-the-counter benefits. So there's a lot of extra benefits out there that I really want to educate people about. I was just talking to someone yesterday. They actually had a plan and they've had all these benefits. They had unlimited transportation for $0 copay. to go to the doctor, go to the hospital, go to the clinic, and up to a 60-mile one-way trip. And they didn't know that they had it. They didn't know that they had the over-the-counter benefits. They didn't know that they have $3,000 a year for hearing aids. And so every plan is different. And I really like educating the residents and also the RCFEs so they know what is available for their residents. And I suggest actually on a face sheet or next to the phone or in the office, knowing what resident has which benefits to make sure that you guys stay on top of it to be able to help care for your residents in the best way possible. And for me, it's about giving that education and then also getting them signed up for a policy that suits them and gets them what they're looking for: lower cost, maximum benefits with the doctors that they need.
Awesome. Yeah, the transportation piece is something that I was unaware of, and that can be a game changer, I think, for some smaller assisted living providers where transportation can be a challenge to organize. And we know, according to regulations, we are responsible for organizing that. It certainly would help if it was also paid for. So that's pretty cool.
Yeah, 100%.
So you had mentioned that you would like to educate people on this. Is this something that you do? Do you do like a Zoom for a group, or do you go to locations to do this kind of training? How do people get educated through you, Lance?
Yeah, Greg, that's a great question. So there's multiple ways I can do it. I'm actually located in the Sacramento region, but I'm willing to drive and to travel as well. So I've got clients all the way down to Southern California, Kern County, Stanislaus County,
Right.
over in the Bay Area, up north towards Eureka. So all over the place. And so I can go to them. There's a lot I can do over the phone. The education, I can come in and do an educational seminar and also talk about, really, I like to educate the administrators, the care staff, resident care coordinators, health directors, and let them know what key things to be looking for. And then actually they're a great referral partner. So then what really helps is they refer a resident to me, and the resident will contact me, or I'll get invited to the community and then come and just share about some of those different benefits. I can also do it over Zoom. So I'm really flexible. I understand the benefit of face-to-face with many communities and the elderly population, but also the benefit of technology.
Yeah. Oh, that's good to know. Lance, you had mentioned also to us that people who have certain ailments like diabetes and heart disease, there may be some things that they need to know.
Yeah, this is awesome. A lot of times people think there's Medicare, there's standard Medicare, but there's a ton of options, and it varies by county typically. But there's a lot of plans out there that are called special needs plans. And so there's dual special needs plans, those are D-SNPs, and there's chronic special needs plans. The D-SNPs are for people who have Medi-Cal and Medicare. So they got both of the cards, Medicare and Medi-Cal, and especially a zero cost, zero share of cost. Then there's special plans for them where they have significant benefits added on to that. Mm-hmm. The other one is a C-SNP, and that's for people with chronic ailments such as diabetes and heart disease, and a few other ones as well too. But where the benefit comes is, so CMS, the Center for Medicare and Medicaid and Medicare Services, actually pays the insurance company to manage your health in an HMO plan. Benefits of the chronic special needs plans are specific to diabetes, heart disease, and a few other ones. And the diabetic benefits are huge because in an HMO plan, such as if you have like Anthem or Humana or Brand New Day, some of those different plans out there, They are to manage your care. And if they can see you going to the hospital less, the doctor less, the specialist less, the urgent care less, because they're helping manage your care in a better way by giving you some added extra benefits, it actually protects your health, keeps you from serious health ailments, and then thus costs them less money. So they can give a few $100s a year of over-the-counter benefits to keep the right vitamins in you. It benefits everybody.
Yeah, that's really great. So that's something I think a lot of people are unaware of. And it sounds to me, Lance, like you've got sort of nuggets of knowledge that you want to share with not just the assisted living administrators, but their clients, their residents, because there are benefits that are out there that many may have to their avail. And you did say it varies from county. And that's another point you had mentioned too, that when you're moving, if you move from county to county, there's some important details that we need to be aware of. Is that right?
Yeah, exactly. So especially if you have a Medicare Advantage plan, an HMO is a plan where you utilize certain doctors. You have a primary care physician, and they do referrals to other specialists. Now, if you move from one county to another county, your doctor system changes. And so pretty much by law, you have to be able to change your plan, or you could potentially not be covered in the new area that you're at. And so if you move from one county to another, you get a resident that came from Northern California to go to Southern California, or vice versa, or even just counties in Sacramento here, from Yolo County to Sacramento County to Placer County to El Dorado County. Those plans change. And so it's very important to make sure you can actually change a couple months in advance before that move to know that you've got an effective healthcare starting that month of your move. So it's very important to be able to do. One of the other benefits that you had mentioned is transportation as well. And I was just talking to a community who doesn't have the transportation, a bus, like some of the bigger communities, and they don't have someone dedicated to transportation. And so that one's really beneficial because you can do, some of them have a cap of how many one-way trips you can do a year, and some of them have unlimited one-way transportation trips for approved trips. Many of those definitely to the doctor, to and from the hospital, to and from the pharmacy if they're picking up prescriptions. So if they want to go to a Safeway, they can get some groceries and some of their prescription drugs, or even over-the-counter supplies. They can get transportation to those places, which is just a phone call away to schedule. It makes it a lot easier on a lot of communities.
Oh yeah, it would. Well, before we part ways today, Lance, I just want to touch on one final thing. You have some materials that you would like to share and make available to assisted living providers and, of course, the residents of assisted livings. Do you have a sample of that and that we could?
Yeah. If you have been to Reno or Vegas conference this year, you've seen this flyer. So this is one of my flyers. I got an 8.5 by 11 or a smaller brochure size as well. I would love to be able to send these to you at your community and to be able to be in every welcome packet throughout California in order to be your resource. So next time a resident asks you a question about Medicare, you can give them this flyer and say, hey, talk to Lance. He's well connected in our community and be able to be a huge support for you. So would love for you to have this, would love to be able to be your resource. So you don't have to think about it or research it, just send them to me.
Excellent. Well, Lance, thank you so much for your time. I'm sure that our client base, our membership appreciates what you do. And I know a number of them already engage with you. It's certainly been a pleasure to know you for so many years, and we intend to continue asking you questions and looking forward to the next time that we can kind of have a video chat like this. So thanks a lot.
Thank you very much.
All right. Take care.